Hello, everyone, and welcome to the Medical Travel Company podcast. My name is Seetal Savla, and I will be your host for this session. I'm a fertility patient advocate, a writer, speaker, and now proud TMTC brand ambassador. And before I tell you a little bit about my journey and we talk about TMTC, I would like to say that everything I do as an advocate is to help people like myself to support, educate, and empower people on their fertility journeys, especially South Asians, where in our communities we have to face so much stigma and shame surrounding fertility issues. And that makes it harder to talk about our stories and share the burdens and lighten the load. So yes, before I get started with my journey, I am very pleased to introduce my guest for today, Dr. Rima Rajkhowa. And if you would like to tell us a little bit about your role and what you do for TMTC, that would be great.
Thank you. Thank you, Seetal. I have been working as a consultant gynecologist and a fertility specialist in the UK in both the NHS as well as in the private sector for over 25 years. So it has been a journey understanding all the issues related to subfertility for all couples, particularly in the South Asian community, as I can empathize with them, as I am of South Asian ethnicity as well. So today I am here as a consultant medical director for the TMTC services, and I look after the gynecology and fertility services provided by this company.
Perfect. And so let's dive in a little bit. Let's delve deeper. And could you tell us a bit more about the pathway and how it helps South Asians, particularly British Asians, who are looking to start IVF to get closer to their parenthood goals?
The TMTC pathway for fertility is designed specifically to meet the needs of the British Asian community and, of course, other couples who may struggle to conceive as well.
So my fertility journey goes back some time now. It spanned 6 years. And during that time, my husband and I experienced an early pregnancy loss at around 4 or 5 weeks. We then went on to do IVF because I received a diagnosis of low ovarian reserve. That was through the NHS for the first cycle. And when we didn't receive funding for any further cycles, we decided to go to a private clinic. We did 2 cycles with them. And donor conception was mentioned at that point because the quality and quantity of my eggs was the issue. My husband wasn't quite ready to explore this opportunity. And so we swapped clinics again, another private clinic, to do a 4th and final round with my own eggs. And when that was unsuccessful, we started using donor eggs. We had 1 cancelled cycle and then 1 successful cycle at long last. But sadly, that pregnancy resulted in a miscarriage around the 2-month mark. So, yeah, I always find it very difficult to summarize. There's so many emotions and stories within stories. But in a nutshell, that is my own personal story. All of the treatment was carried out in London, in the UK. And we threw a spanner in the works in late 2020 because we decided to move to Berlin. And so when we started doing the donor cycles, I traveled back for the transfers. But we never really considered going abroad for various reasons. And we can talk about those a bit later. But that is definitely an option for people with more and more options these days in different countries. So in terms of the challenges, the main one for us was all the waiting. We had to wait a full year for our NHS cycle to start. And that was because of all the fertility investigations, waiting for results, waiting for the funding to be approved. And this is precious time that you feel like you're just wasting because we were in our mid-30s at that point. And once we had been told that we needed to be referred for IVF, we just wanted to start the journey. We wanted to become parents. And we were very conscious that age and time weren't on our side. In addition to that, once I'd gone private, in this particular clinic, I had to also wait for my hormone levels to be at a certain point before we could start a cycle. So again, each time we were losing months and months, and we were only averaging 1 cycle per year. And so that was very frustrating as well. And it added to that sense of uncertainty and lack of control that you have when you're undergoing IVF. Another issue was also the choice of donors. So once we were told that we should consider using donor eggs to improve our chances of conceiving, The next sentence was, if you would like an Asian donor, you'll probably be waiting for about 2 to 3 years in the UK for a suitable match to come up because of the shortage of donors. And according to HFEA data, there are, I think it's about 14% of IVF patients are of Asian origin, of Asian heritage, but only 4% of them are reflected in the donor pool. So you haven't got many donors coming forward for various reasons. And so you have a limited choice, and you may be forced to make difficult decisions and compromises that you wouldn't have to if you were a Caucasian patient. And at that point, you could you're looking at basically giving up your genetics and your heritage, or going abroad, and there may be potentially unsafe and unregulated options there. Cost is also a big factor. We had that first funded cycle, and then after that we went private, which is a privilege. We had the means to do so, but that is also a barrier of to access in the UK. And especially in London, where costs are astronomical. And sometimes transparency is not possible either with certain clinics, particularly the one that we went to as well. You get a ballpark estimate, but then you don't know how many blood tests and scans and procedures you'll need. There are also add-on treatments. And once you're down the rabbit hole, so to speak, the costs can accumulate very quickly. And, you end up with a big invoice on your hands. And that is sort of like a slap in the face once you've had a failed cycle as well. So that was one of the issues and a big source of stress that we had as well. And finally, the support. There wasn't much support, if at all, from the clinics in terms of mental and emotional well-being. And that is a big part of the process. The injections are hard. There is no denying that. No one looks forward to it. It does become easier in many cases. I speak to my own experience. But emotionally, I found it extremely grueling. And there was just nowhere to turn to explore all those emotions and just express myself and talk to someone who truly understood what it was like dealing with all of these, the uncertainty, the lack of control, the hope and the heartbreak, and rebuilding yourself each time. So yeah, there is a lot more to say, but these are the main challenges that I faced on my journey. And so when I heard about TMTC and how they address all of those, I think this is a wonderful solution for British Asians who are looking to grow their families and overcome the systemic and racial barriers that we face in the UK. So Dr. Rima, at this point, I would love for you to talk a bit more about that and how TMTC offers solutions for people in my position.
Seetal, thank you, first of all, very much for sharing your journey. And it is a very hard journey, and I appreciate every word that you've said. So in all the years that I have been working in the fertility clinics in UK, sadly, I've heard this story many, many times. And this is a very difficult journey, and I think that circumstances make it even harder. So the points that you have identified, which I clearly empathize with and I understand and appreciate, are, first of all, the long waiting times to be seen for the test results, for actually being told what treatment you need. And then to begin the journey and then suddenly have a lot of unexpected costs come up, which you didn't plan for and you didn't budget for, but you're too far into the whole journey to step back. The third thing is accessibility to donors. I mean, not everybody needs a donor, but when you are told you need a donor, it is a mental point where you have to accept it. And when you've gone down the journey of accepting that you need a donor, you want to just get on with it. So you then go to the clinic to say, right, I'm ready to start. And then you hit the biggest hurdle. That, sorry, the waiting time is 2-3 years. We don't have any Asian donors. And unfortunately, as you've said, the statistics are that for the last 3-4 years in the UK, there's always been a shortage of donors of all ethnicities, but there were 1,200 Caucasian egg donors compared to just 60 British Asian donors for the whole of UK. And this has been a consistent pattern since 2021, 22, 23, when I looked at the HFEA data. And so this becomes sometimes a really big barrier, because for couples, if you can't start treatment, you don't have the right ethnicity for your donor, they either drop out they wait and feel tired and frustrated if they have to keep waiting, or they choose a donor of different ethnicity to be matched as closely as possible, which is not wrong, but it does need a lot of mental adjustment because there are lots of questions that you have to accept. And at TMTC, we also therefore have got these very clear things that people do travel overseas for treatment, but the HFEA has got a very justified warning that if you travel overseas, you have to be careful because the clinic overseas are not all regulated and you have to get the information correctly. So we took all of this information together, and because I'm extremely passionate about the fertility treatments we offer our patients, and I feel very much for our British Asian patients, I felt that there is a need, there is a gap in the service that we can actually help couples. So first and foremost, we addressed the standard of care. We wanted to know that if you travel overseas, the standard of care that we provide for our patients should be similar to global standards as what you would expect if you were in UK. So we have come up with this very clear pathway that we are confident that we are listening to the HFEA and to our patients. So we have a highly experienced UK consultant team who liaise directly with a selected, screened, vetted Indian clinic and a consultant in India with whom we feel that we work the same way. So we have a partnership, a UK-India partnership of UK consultants, Indian consultants of the same caliber, and clinics which have been vetted and licensed. We also feel very confident because India now has an ART Act which requires clinics to be licensed and the practitioners to have particular levels of care. So we have screened and collaborated with clinics who are like my friends and colleagues here. Once we have that partnership, the patient then is provided with a treatment diary and a treatment plan that is something that she would have in UK and which is agreed by both the UK and India team. We then support them with this is the big thing that you have said, the support. You are not left on your own to say, where do I go? Where do I stay? When do I make my appointments? Not to talk to people you don't know. You will be talking with a team who knows you and you know them by name. So it'll be a named journey, one person, one consultant, one team member who will guide you through the journey. And then once you are in India and you've had your treatment, you come back to UK and you come back to the UK team, the doctor who's looked after you at the initial consultation, because now you have a real good rapport with each other. And then this consultant will make sure that if you have a pregnancy scan, which shows a healthy pregnancy, you are referred back to the NHS, to your GP, which is very similar to what I used to do as a privately practicing UK consultant in the UK. So we want to make it seamless without any gaps. So there's no lack of support all the way. And of course, on top of that, as you said, mental well-being is so important. And we are so fortunate that we are able to offer a wellness package that they can have access to while they're in India to make sure that they feel looked after. And they have that because the brain controls everything. If you are relaxed, everything will go better. And so we're trying to make sure that that is available to them. And finally, the most important thing you brought up is affordability and transparency about costs. We are ensuring that before they start on this journey, they're given an actual cost absolutely to the last letter to make sure they know what they are going to be asked to pay. The invoice, of course, unfortunately, there is going to be a payment, but it will be what they know and what they expect at the start.
Thank you so much, Dr. Rima. There's a lot that I would like to pick up on, starting with the costs. And in the UK, as I mentioned earlier, the cost can be extremely high. So anything up to £9,000, if not a few more thousand, for a donor cycle using donor eggs, IVF cycle. And, we're not talking a small amount of money here. Yeah. How does the TMTC pathway, how do the costs compare to the UK?
So we have studied this very carefully. If you look at the clinics all over UK-wide, the cost for a donor egg cycle can be 6,000, say, in an NHS clinic where there are longer waiting times and not as much of a personalized care, to about 12 to 14,000 in the private sector. In addition, donor egg treatment in the UK very much now largely depends on frozen donor egg banks, where there is a risk that the donor eggs may not survive the freeze thaw. And that can happen to about 15% of patients that access this treatment. So we through the TMTC pathway, the cost of an egg donation cycle will be about £5,000, including the cost of the donor selection. It includes the cost of the medication for the donor, but the cost of the HRT that the recipient will need may be a little bit more. So if I round it up to about 5,000, 5,500, which will be the upper limit, in some centers, in some cases, it can be lower, up to £4,000. And on top of that, you will need to consider the cost of travel. So if I ballpark it to about £6,000 to £7,000 for one cycle with fresh donor eggs, with a pregnancy rate of 50 to 60%, and a confirmed guarantee that they will have a blastocyst transfer.
Okay, thank you very much. And the big question, why is it so much cheaper compared to the UK for an IVF cycle using donor eggs and medication? And then also the entire package, which is all inclusive. So with the travel, the accommodation.
So first of all, I want to reassure everybody here that the donors are not paid more than what the expenses are over here. So it's of similar levels of reimbursement. I think perhaps the overheads are lower for the clinics, and this is the charge that the clinics make, and we just facilitate the journey. And the cost can be variable depending on the standard of the clinic or depending on how much of screening you want from the donor. The donor in India is anonymous, and you will be matched to physical criteria as in height, weight, hair color, eye color, blood group, etc. But you may want to know more, say educational status or, whether they've had children, etc. And that can make the wait a little bit longer, but ultimately it doesn't make it so much more expensive. So they are screened to the same level as the EU tissue directive, which we would do here, but not perhaps. And these are something that, again, if they want more screening, say for genetic conditions, etc., that can be done, but the cost of implications will be there. So why is the cost lower? Probably because the overheads are lower, not because the donors are mishandled or mispaid.
Exactly. From the patient perspective, the reason behind the question was, the immediate thought that might come to mind when you think about cheaper packages abroad is because corners are being cut, or the standard of care may not be to the same as it is in the UK, to the same level. And so I wanted to address that concern that listeners might have.
Thank you for asking that question. It's such an important question. And I want to confirm that, yes, we definitely meet the global standards. And I would not be here if there was any concern about it. This is very important. Clinical governance is really important.
Thank you. And in terms of the donors, we mentioned that there is a much wider pool for British Asian couples looking to conceive with TMTC. But could you please tell us a little bit about how the donors are recruited and how they're taken care of as well? Because it's important to have a wellness package for patients. We've touched on how difficult the process is physically, emotionally, and mentally. But also for donors, they're going through almost the same process as well, bar the embryo transfer at the end. So how are they taken care of?
Thank you for asking that question. This is such an important one. So since the ART Act in 2021, India has got very strict rules as to who can be recruited as a donor. So donors cannot be recruited by a clinic. So there is no pressure on them. They are recruited through independent donor egg banks in the same way that we recruit them here in the UK through social media campaigns, through referral by friends and family. So the donors come through on their own. They are women between the ages of 18 to 35. Perhaps there is a greater openness in discussing about donation in this age group in India than there is here in the UK for whatever cultural reasons. So once they come to the donor egg bank, they have this straightforward screening blood tests that are required by law, by the EU tissue directive. And then they are only after they have been selected by the host couple, by the recipient couple, will they be seen by the clinic. So there is no pressure on them. And the payment is exactly so currently in the UK, donors are paid an expense of up to 900, I think it's around 950, I think maybe 35 or 85, 985 pounds. And I think it is exactly the same amount in India. The protocol for stimulation is very much towards reducing risk. There is no hyperstimulation permitted because the law in India says that no more than 7 eggs can be donated, can be fertilized with the recipient. So, and the donor can only donate once. So there is no benefit in overstimulating and getting more eggs because those eggs cannot be used and will not be. So there is no very little risk, is minimal stimulation, and the eggs are used for only one couple, and the donor is only allowed to donate once by law. And there is an Aadhaar card, which is an identification number, which is how they can be checked that have they donated anywhere else before they come to a clinic. So the safety measures have been considered very safely, and the protocols that the donors are used are exactly the same protocols we use here.
Now, I wanted to touch on that because we speak a lot about the recipient couple, the difficulties and the challenges, the complex feelings of grief that can be associated with losing your genetics, going down this donor conception path, because to be honest, it's not the dream that we have since we were young of
absolutely.
Using assisted reproduction to start our families, and there's a lot to get our head around, but we rarely focus on the donor and their experience of it as well. So it was important to me as someone who has used donor eggs to know that they are also being looked after as well.
And absolutely respected as a patient, no different to a patient couple. Absolutely no way. And that is why I personally visit the clinic and speak with the doctors to understand their ethical standards.
And you mentioned the wellness package earlier, and India is very well known, very famous for practices such as yoga and meditation, Ayurveda. Could you talk to us a little bit more about that, the type of services that you offer for British Asian couples who may wish to take advantage of this while they're away in India?
So we have an aftercare facility where they can actually stay while they're having their treatment. Currently, there's one in Delhi that I have visited and stayed in, where they have dietitian support to help them. They have availability of a studio where they can have yoga, where they can have a yoga instructor, and there is connection with wellness spas that they can also take on when they are there. So acupuncture, definitely yoga, definitely meditation, all of that is supported by actual people who come to the center to fit around the clinic visits to help them relax and to make sure that they're well looked after. So, it is a good package because it is all holistic and it's all there. And it is something that will be discussed with them prior to travel to say what would they like and how would they like to take it forward. Not everybody will want it, but some will.
Yeah, that's very true. At the beginning, I'd heard about acupuncture and I was slow to take up yoga and meditation. I wasn't so interested. I think the focus was solely on the physical aspect of the experience. And as the cycles went on, I thought, let me try something different. We're switching up the protocol, but I'm not introducing any holistic treatments, to also do something on my side to make sure that I'm in the right mental space to get the best out of this process. And so I did do acupuncture. I think I started around my fourth cycle, and who knows about the impact on the overall outcome. But in any case, I enjoyed my sessions. I had a wonderful therapist who was who had a lot of experience dealing with fertility patients as well. So we had good conversations. It felt a bit like therapy, and it was relaxing. And I think that is the most important point, really. Like anything that we can do to de-stress ourselves during this time is very welcome.
So I think that you're absolutely right. First of all, yes, absolutely. There's no strong evidence base to say that doing this will improve your success rates. But we do know that reducing stress, improving your sleep, all of that does improve your success rate. And perhaps indirectly, they will be helpful in making the journey easier.
And all of these services, which ones would be included? The packages can be customized depending on what the couple desires.
There will be additional cost perhaps for these additional things that will be factored in.
But as you said, not everyone may wish to have it. Not everyone may have the time or the finances for it. But it is good to know that these options are available should they wish to complement their therapies.
And it is within the setting of the place where they will be staying. And therefore, they don't have to go out of the way to hunt for things themselves. It is all available if they request it.
And in terms of the clinics as well, you have several locations across India, I believe?
Yes. So we started off in Delhi. The main clinic, the main places that we initially started off are in a place called Gurgaon in Delhi. But now we have got clinics in almost all the major cities, starting with Mumbai, Bangalore, Chennai, Hyderabad, Ahmedabad. These are the ones that most of our patients have asked to have their treatment center to be located. So these are the main ones we started, but we are going to extend. The reason we have chosen these major cities is that the standard of the clinics are higher because they have a higher patient load, and therefore they are better able to serve the needs of our patients. We do not want to go to a place where the website looks absolutely beautiful, but when you go to the clinic, you feel a bit concerned that what if the electricity goes and the embryos are in the incubator, what do they do? So you don't want to go to a clinic where there is no full setup. And we're going to clinics which are absolutely set up for all kinds of risk.
Yeah, speaking of unfortunate, unforeseen circumstances, what if something goes wrong? Obviously, we go into this with the best intentions. You've done your due diligence. And if there is an issue with the embryos, maybe with travel and logistics on that side, but more in terms of the medical treatment, what can patients do? What is their first port of call?
So we have a complaints process, obviously. I mean, it's very important that patients report to us immediately if there are any concerns at any stage of their journey. And if it is something that can be addressed by us immediately on the ground, it will. Otherwise, like all services, we can escalate it to the chief executive level. And then if there's something here in the UK that has not met their standards, then they can go to the ombudsman, because that is where all private sector clinics can have to finally go to if there is dissatisfaction. And in India, they will have to go to the clinic initially. And if the clinic doesn't meet, the response from the clinic does not satisfy them, then they have to escalate it to the local licensing body. And we will make a clear pathway available to the patients so they know how to proceed.
Perfect. You anticipated my question, because I was wondering how would they be supported through that process by TMTC as well? Because it's good to have the process, but will they be told what to do?
It'll be shared.
Because when you're in this on the fertility journey, and there are so many things to consider as well, not just the medical treatment itself, but if things go wrong, you don't necessarily have that the headspace and the capacity to deal with that. So yes, you are looking for your life to be made easier and more streamlined.
Yeah, and we have got a CQC license now for the treatments carried out for the clinical part that we do here. So there is oversight in what we talk about and what we provide, meeting the UK standards.
And I know it depends on the nature of treatment and on the individual case, but on average, how long can couples expect to stay in India per cycle?
So we can certainly customize it to their needs. So first of all, if they're considering IVF with their own eggs and sperm, the important thing, I guess, the cost saving is that the drugs are included in the cost of the treatment in India. And they are the same drugs that we use here, the international ones, because I have made sure that we use the same medication and there's no compromise on that. So if they're going to use the medication in their package, then they will have to stay there for up to 3 weeks, because it's about 10 days, 12 days to egg collection, and then 5 days to embryo transfer, and then they return here. If there are any spare embryos, they can be left in storage there. So they have to budget for about 3 weeks of time away from UK. They can stay in this aftercare facilities, or they can stay with their home, or they can travel around a little bit if they want to while they are there, but they need to be able to attend clinic visits. When they come back to UK, they're back under the care of the UK consultants. So it's almost a seamless journey. If they are going ahead with treatment with donor eggs, so everything, including the selection of the donor, etc., can be done here. They can start their medication here and be in India this is the minimum amount. They can stay longer if they wish to, at least 4 or 5 days before the egg collection for the donor is planned. And then once the egg collection is done, the embryo transfer, so a minimum of 2 weeks is what they would need to stay there if they're going for donor egg treatment. They can, of course, stay longer, and there will be some situations where I might say you may have to stay longer. But at the very least, I think you can't just go there and come back straight away. So you have to have that amount of time. But there is facilities in the aftercare center for working from home, because we have strong internet connectivity. There is rooms where they can do their work quietly. So all of that is available to try and make sure that we meet all their needs.
Yes, that's good to note, because I remember that from all the waiting rooms in the different clinics, the women and some of the men as well on their laptops, frantically typing away, taking calls, and work doesn't stop. Sometimes we want it to stop. Sometimes it can't stop because of the nature of our work as well. I was fortunate that I had flexibility, but it's not always the case. So it's good to know that remote working is possible, that the center is set up for that as well. And sometimes it's a nice distraction as well, I think. I personally prefer to focus on the journey, and that helped me to feel more empowered and take back control. But for other people, just staying in touch with the regular world, so to speak, and because it can be very all-consuming to go through IVF. I think it's nice to keep a toe in that so that you don't get dragged under and overwhelmed by everything, I think.
And I think we have to be sure that whatever makes the patient's journey easier for them is available to them. And I guess one of the biggest stressful areas is the waiting. What we are trying to do is to build everything, the treatment around the patient's own availability, their time, what suits them, we'll match it with them. So it's not that they have to go, treatment will have to start in 2 months, otherwise you miss your slot. No, that's not the case. So when you're ready, we are ready. We'll work around you. You don't have to work around us.
It's good to know. And one last question about the treatment, the medical side of things. You were talking about embryos, and if you have a cycle and then there are additional embryos left, are couples able to bring over frozen embryos from the UK if need be?
No, they're not. If they have frozen embryos in India, they will have to go back for the frozen embryo transfer to India. There is no, the HFEA will not permit any embryos from any other country which is not regulated, where there is different regulatory systems to be brought into UK. So yes, no, I can confirm that we cannot bring embryos back to India, from India to UK.
Okay. But if I was a patient and I had frozen embryos in a clinic in the UK, would I be able to take them to India for treatment? Or would I need to start again and create fresh embryos?
That's a question. So that I will need to clarify, because I haven't been asked this before. But I know that from UK to transfer embryos to another center, we need the permission. We need information about the credibility of the clinic there. And we need to know what their ISO standards are or what their regulatory standards are. So it will not be easy to actually take embryos from here to India for transfer. And I frankly don't see any benefit in it.
No, it's a long way for them to travel.
No,
When we were doing it, no. When we did our own treatment, we had 2 frozen embryos left from the second donor cycle, and we did consider starting treatment at a clinic in Berlin. But because the regulations are different here, egg donation is illegal, as is surrogacy for the time being. Yes, in Germany, they are quite strict about that. And because these embryos were created using an egg donor, that automatically ruled them out. So we had to go back to the UK for treatment, which in a way was okay, because every time you have to start over at a new clinic, it can be very overwhelming. I think you're getting used to new people, and it's just, as we mentioned, that consistency of care and familiarity of surroundings is extremely important as well.
So one of the big reasons why a donor egg embryo cannot be transferred from India to UK is the lack of donor anonymity. The HFEA regulators will not allow any gametes where the donor has not signed up to lack of anonymity to be transferred. So even an embryo created in Spain cannot be brought into UK for that very reason.
I'm glad you mentioned that, actually, because that was one of the reasons why my husband and I wanted to stay in the UK. We were adamant that we wanted a non-anonymous donor, and because anonymous donation is not permitted, that worked for us. The thinking behind that is that we wanted our potential child to have access to the identifying information of their biological mother if they so wished. But it is an extremely personal decision, and there is so much to think about as well. Some people prefer anonymous donation, and it can be a much faster process as well, which, as we said, once you know you need to have a donor, you need to have treatment in order to conceive, then you want to be making steps in the right direction, basically.
Yes. And I'm glad that you have mentioned this again. So I do want to highlight that there is donor anonymity in India. So this is an important consideration for some couples which may not be appropriate for them. And this will be confirmed at every consultation. So this is something that they will know of even before they begin anywhere near starting that journey.
Having said that, even if we choose an anonymous donor, I think nowadays with the prevalence of DNA testing, who knows where we'll be in 10, 15, 20 years' time. And you may have access to that personal information pretty easily, whether you want it or not, I think.
And the other important thing, I guess, is the 10-family rule in UK, where a donor can have up to 10 families. In India, it is a 1-family rule.
Yes, that is a concern. In the end, we decided to donate our remaining embryos, and we wanted to donate to another family, preferably a South Asian family as well, because my husband is South Asian. There's a shortage of donors, as we mentioned, and to give another couple the opportunity to get closer to their parenthood dreams as well. But unfortunately, our donor withdrew her consent, and so we were unable to do that. We donated them to the clinic for training purposes instead. But there's so much to discuss on donor conception, which we could do a separate episode on as well. Lots of considerations and feelings to take into account.
And it is not an easy discussion, but it is a very important discussion.
It's not a quick switch to make as well, as you mentioned. IVF in itself, I think for me, I felt very overwhelmed at the beginning. It took me a good couple of years to accept that we were on this journey, that I needed help in order to have a baby, and that there were no guarantees. And I let it happen to me, not for me. And it's only as I became more familiar with the process, with the clinics, and accepted that this was my path, that I was able to then take some control, make decisions, be in the driver's seat as opposed to going along for the ride. And that is a big part of my work. As I mentioned at the start, it's a very, very difficult journey, especially as a South Asian person. And to be able to offer people hope and support is definitely one of my passions, as it is for you.
It is. And the important, I guess, is that nobody can guarantee you a family and a child. But what we can do is do our very best to make sure that the journey is easy and to make it as successful as we possibly can.
And I think that's a beautiful note to end on, very hopeful and optimistic. And thank you very much for your time and your expertise, Dr. Rima. Are there any closing words that you'd like to share with us, words of wisdom?
No, and it's a pleasure to speak to you. And I'm so proud of you for doing this advocacy.
Thank you so much.
It is so important to share your experience so people know that there are others who can ease their burden a little bit.
Yeah. And thank you very much for shining a light on this wonderful opportunity for British Asians to get closer to having the baby in the family of their dreams. And if they would like to know more about TMTC, the pathway, what can they do?
There is a 15 minutes free mini consultation that we can offer to make sure they understand whether this is an option for them or not, because that will be with me to tell them, yes, it's okay for you to consider this further, and to send them the costs, and then they can decide whether they actually want a full consultation.
And just quickly, before we finish, what do you cover in this 15-minute free mini consultation?
I first of all check that they are suitable to travel. Secondly, that they meet the upper age limits. The female age for treatment, even with donor egg, is the 49th birthday, because they have to have had the baby by the 50th. The male partner's age has to be the 54th birthday, because 55 is the cutoff. The BMI, ideally 35 or less, though I will have a look at 35, 38, depending on how much time they have to lose a bit more weight. And to ensure that, say, if they are a diabetic or something, is it right for them to travel? So I will do that and then see what the previous treatment history or test results are, so that I can send them a cost estimate for the appropriate treatment that I would recommend for them.
Brilliant. Okay. And so the link to sign up is on the website, and it's also possible to do so via LinkedIn and Instagram, as you said. And thank you very much for your time. It's been an absolute pleasure speaking with you. And if anyone has any questions, please don't hesitate to reach out to Dr. Rima or to myself as well. I'm at Seetal Savla on Instagram. That's the best place to find me. And I'm a proud ambassador for TMTC. And it's so absolutely amazing to have this solution that offers British Asian couples the opportunity to have faster access to IVF, consistency of care, lower costs, and more choice, basically. Hope without having to compromise.
Yes. Thank you for summarizing it beautifully.
Thank you.
Perfect. Thank you.